So this is Chapter 12, Part 2 on preschoolers. So this age, they have accomplished toilet training by now and are much more independent with toileting, eating. They can dress themselves. This is a nice age. They really want to please the parent or the primary caregiver. They have internalized some of the family values. So, if we don't hit, we are kind, they see that as good and try and follow that. But not every child is as compliant as others, and they have figured out that they don't have to do what they're told all the time. So sometimes they will challenge what the parent is telling them. This is the age of associative play, and this is my favorite to watch. This is the kids who run around yelling, "Let's play monsters." And one day they are monsters and run around growling. The next day they're chasing monsters. And somewhere in the middle of the game, a kid will say, "I'm the monster." And so then they all chase him. And then he'll say, "No, the monster's over there." So then they all run that way, screaming and flailing their arms. And they're just so cute. They're playing with each other now, not just next to each other, but there are no rules. The rules change in the middle of the game. They also love imitative play. So this is where they'll play house, play doctor, play school, play whatever. It's an age of they're very imaginative in their play, and imaginative playmates are very common. And again, something to just reassure parents, this is normal. Don't worry about it. And dramatic play. They love dress up and pretend and all of that. So here's a girl playing doctor and fixing her bear. Coping with concerns. They're heading off to preschool and getting ready for kindergarten. So there are a lot of screening processes out there to decide if a child's ready for kindergarten or not. And it really is important to make sure the child's ready and has a good school experience. And starting the year behind rather than when they're really young, young for the class, it's usually going to be worth it. So as they're around all these other kids, teaching them to wash hands is important. And then just making school a good experience. So letting them see the classroom before they start, doing what you can to make it feel comfortable and not a scary transition, and teaching them to wash hands. Sex education, this is the age they're going to ask you, where do babies come from? So it's important to figure out what they're really asking. Give an honest answer. Don't say things that aren't true, but don't over answer. They're usually just have a very limited curiosity. Maybe a friend's mom is pregnant and they just are wondering, is every mom pregnant? And, so they don't need a lot of scientific answers. So figuring out what they do already know, making sure they're accurate, but then just answer what they're asking, because they're really not asking for a detailed physiologic explanation. Fears. Oh my goodness. These guys, this is the age they are afraid of things. They're afraid of the dark, of being left alone. Many of them are afraid of animals, whether that's dogs or snakes or whatever. Afraid of ghosts. Afraid of people they associate with pain. That means nurses and doctors. What they recommend is kind of desensitizing them. So don't just tell them, get over being afraid of the dark. Here, we're slamming the door. Use a nightlight. Don't just make them go pet a big dog. Let them come slowly to a little cat or something, a small dog. First it can be in the other room, and then they can get a little closer. So let them come in slowly, and letting them help in figuring out what will help them get over the fear is also a good idea. Aggression. This is defined as a behavior that attempts to hurt another person or destroy property, and some kids are just more aggressive than others. It's a biologic change, sociocultural, and then just some family variables. Some families are rougher than others. So it is something we, as they're starting to be together in groups in preschool and kindergarten, that we need to make sure we keep it in check. So modeling for them what is acceptable behavior and making sure they understand what the expectations are. Speech problems. I told you their speech is just developing like crazy during this age, and part of that huge rapid development, stuttering and stammering, are very common. Their brain is going faster than their mouth can form the words. So the kids can say, I want to go. Or they say, I want to go, I want to go with you. So the difference is struggling on the single sound or word, or getting halfway through the sentence and not quite repeating it before you can finish. Doesn't really matter. Same thing. Just be patient. This is normal. They will learn to speak normally. And if they don't, if this does progress, this is one of the easiest speech problems to work with. So a speech therapist can work with them later if they don't outgrow it, but the vast majority of them will. So just be patient, let them finish. I think parents want to jump in and speak for them, but tell them be patient. And then dyslexia, articulation problems, right? Little kids don't make R's very well. Their S's can be lazy. So all of that can be very normal. And they usually outgrow it. And if not, those are things that speech therapy will work with later on. Okay, so promoting optimal health, nutrition. This age, they don't need as many calories per kilo, 90 calories per kilo. It's very common for them to have a phase where they will only eat raviolis. And then you go out and buy a mass of raviolis and they decide they don't like raviolis anymore. They only want something else. So strong preferences, and, fad foods. They love something one week and then they're done with it. That's common in this age. Our goal is that they overall have a nutritious diet. So, eating, limited, variation one week, but the next week they have great variation, we're okay with that. Sleep and activities. They should be sleeping about 12 hours a night at this age, and most of them are not taking naps anymore. So they've given up naps, but they're sleeping long at night. And that's because they play hard during the day, and we want to encourage that. We want to make sure that they're safe and that it's fun. So don't work too hard on getting them into activities that are, have rules and are, the early soccer or t-ball or whatever, because most of them just want to run and scream and yell. Nightmares and sleep terrors are common at this age. A nightmare, they wake up from it frightened. A sleep terror, they cry out in their sleep, but they don't wake up. And if you go and wake them up, they're annoyed at being woken up, so they don't remember it. So the treatment for this is a little different. A nightmare, a parent needs to go in and reassure them because they wake up frightened. If they cry out in their sleep but they don't wake up, they probably are having a sleep terror and won't wake up and won't remember it when they do wake up. So the parent doesn't need to wake them up and comfort them. Consistent bedtime routines. That helps a lot. So the child knows before bed, I always get to watch, my favorite video, and then I brush my teeth and I read 2 books, or, having some sort of a routine to let them calm down and quiet down before bed will help them in falling asleep. Dental health. This age, now they've got all of their baby teeth in, so we really do want professional care. We want them getting fluoride if it's not in their water. And at this age, the parent still needs to brush their teeth. They're going to want to try, but they don't really do a good job, so we need to help them out. Injury prevention. So This is no longer the age where the parent is just hovering over keeping the child safe. It's now time to teach the child what to do to be safe. So they're old enough to understand some safety education. And as far as using protective equipment, this is the age we want to start it, because if we don't start it now, we're never going to get them to use it later. Car seats are required up until 4 years and 40 pounds. So if you have a lightweight kid, they're going to be in a car seat. This is the 5-point restraint. You see the 2 at the shoulders, the 2 at the hips, and the 1 at the crotch, right? 5-point restraint until they are over 4 years and over 40 pounds. This one is not an or. They have to do both. Then after that, they can move to the booster seat until they're 4 feet 9 inches tall. So as I've been saying, in this age, we're shifting from protecting the child to teaching the child safety. So children are going to begin questioning previous teachings, especially when they see inconsistency. If the parent says you have to be in a car seat, but the parent doesn't wear their own seat belt, right? So being consistent is going to help, because they're going to notice. And at this age, they like being around other kids. They do that associative play, so there aren't real rules yet, but they enjoy being with other kids.